My name is Jamie Reed, and I am a clinical research scientist. I am a lifelong Democrat, a mom of 5 boys, 3 of whom were adopted out of the foster care system, and I am a lesbian. I am also the public whistleblower from a pediatric gender center where I was once, like my fellow Democrats, a true believer. I saw patients from the age of 3 until the age of 26, and I worked with nearly 1,500 unique patients. I have lost my clinical research career and my 5 children's college tuitions because I had to follow my ethical clinical training and blow the whistle on these practices. This field is currently harming children, and you will hear from many of those children today who will tell you that they need these interventions to save their lives. That is not true, and I can tell you that from working with this population that what they need is the truth. Many of these young people would simply grow up to be gay if left alone. These interventions themselves are profoundly homophobic and regressive. I live in a state now that has restricted the use of puberty blockers, cross-sex hormones, and surgeries in minors, but these restrictions were too late for my patients. It was too late for my patients who had her breasts surgically removed and called us within 3 months begging for the surgeon to put her breasts back on. Another patient, a young woman we put on testosterone, called our center. She reported that she was bleeding heavily. We told her to put on a thick pad and call us back in an hour if she was still bleeding. She called us back 20 minutes later. She had bled through the pad, her underwear, her blue jeans, the towels she had wrapped around her waist, and her bed comforter because her vagina experienced a deep, intense laceration that required surgical repair within a children's hospital. Why? Because we put this child on testosterone, which permanently degraded her vaginal canal. We now have an international consensus led by Finland, Sweden, the UK, and countries that Michael Moore would even agree are good liberal places. And these interventions are not supported by evidence. The American Academy of Pediatrics has been sued by harmed patients. They cannot publicly walk this back due to these current lawsuits. Today is International Detransition Day, a day reserved for recognizing and remembering those harmed by these interventions who deserve justice. On this day and every day moving forward, know that we, the adult gays and lesbians, will no longer stay quiet as this homophobic specter robs proto-gay youth of their sexual function and their health. I will forever hold the knowledge that I hurt vulnerable children. I do not want anyone else to carry this pain.